Hi everyone, I hope you're keeping well. Due to the unforeseen circumstances of COVID and the lockdown, the UJ clinic is closed. So what I've decided to do is just to do a short video just to show you guys the positioning of the T-spine AP and lateral. I hope this will help you. So let's get started. So some of the most common indications for doing your thoracic spine x-rays would be your trauma, like MVAs and falls, your degenerative changes like your osteoporosis, osteopenia. You're also going to get your infection and inflammatory diseases like your cancers, your TB, multiple myeloma. Basically, before our patient would come into the room, you need to set up your tube and your image receptor. So most importantly is just to make sure that your X-ray tube is aligned to your image receptor. It should be perpendicular to each other. Your FFD that we're using is 100 centimeters. That's just to ensure that you're having nice detail of your thoracic spine. For the T-spine X-rays, we need to use a grid. The reason is that the image or the area that we are X-raying is greater than 10 centimeters. It's important for us to use a grid as it just reduces the scatter radiation that is caused and improves the image contrast and the image detail. Okay, so the direction of our centering ray is actually your vertical direction. So now we're just going to move on. So what happens is just to take note that when you're writing your exams, you need to mention, or if whatever the case is, whether it's done erect or supine, that will also determine what's your centering ray. So because this patient is lying supine, the centering ray is vertical direction. Okay, so our first view that we're going to do is the T-spine AP view. So what happens here is our patient is going to lie supine. Just take note of your anode heel effect. Just to remember that the thinner area of the T-spine, which is more the upper portion, should be on the anode side, and the thicker portion should be on the cathode side because the intensity of the beam at the cathode side is higher. Okay, so what happens is you can use a thin pillow, but try not to use a thick pillow because you don't want the chin to be lower down and superimposing on the upper portion of the T-spine. So when your patient is lying down, you need to make sure that the chin is elevated sufficiently so there's no superimposition on the upper portion of the T-spine. And then we're going to make sure that our arms is nicely rested at the side of the patient. So you just ask your patient to relax their shoulders, put their arms down at the side. That will just allow for the sternoclavicular joints as well to be nicely even out on either side. We come down to the patient's hips. We need to make sure that there's no rotation. So you just adjust your patient accordingly, and that will just ensure that your patient is nice and straight. Okay, so the centering point for your T-spine AP is your mid-sagittal plane, midway between the jugular notch and the Ziffy process, which is normally at the level of your T7. Okay, so some of the things that you can do to improve your image quality for the T-spine, one is you can actually flex the knees slightly, just so that you reduce the curvature of the spine. If you have a cushion, you can just put your cushion under your patient's knees. Okay, so just to remember that when it comes to the T-spine, the upper portion is less dense than the lower portion of the T-spine. So it's normally around T1 to T4 because you just have the F-fold trachea, it's less dense. Whereas when you come from your T4 going down to your T12, you have your mediastinal structures, and that just increases the density of the lower T-spine. So to even out the density, you can use filters, which would normally be your wedge filters or your boomerangs, that you can just place either behind the patient, or you can place your boomerang just on the top of the upper portion of your T-spine. Okay, so when you need to collimate for your T-spine AP, the idea is for you to actually collimate side to side. or right to left basically, and avoid collimating a lot from the superior to inferior area. The reason is that you just want to see the entire T-spine in its entire length basically. When you're collimating, you just more or less need to have at least 3 or 4 finger spaces on each side from the centering area. So your marker needs to be readable either on the right or the left hand side. Okay, so with the exposure factors for your T-spine AP, it really depends on the system that you are using. So whether you're using a CR or DR system, but more or less on average, I can say that you could use between 65 to 85 kV and between 32 to 40 MAS. Okay, so now we're going to move on to the T-spine lateral view. Most of the things that we mentioned for the T-spine AP view applies to the lateral as well. We're still going to use 100 FFD. We still need to make sure that our X-ray tube is aligned to our image receptor, and we are going to, or the direction of our beam is still the vertical direction. Okay, so for the lateral supine view of the T-spine, we need to turn our patient on the left side or on the right side. Ideally, it's good to turn your patient on the side such that you are on the posterior side of the patient. Example, we're going to turn this patient X to face that wall. So standing behind the patient just gives you, more support, and it allows you to position better. Okay, so what we're going to do is we're just going to, so our patient is in a lateral recumbent position. I'm going to ask our patient to flex the knees slightly. Let's just push your knees up a bit. Okay. And then we need to put our arms. So I just tend to put the left arm under her head. I just feel like it really helps to even out the spine and to give us a nice lateral view. And then I place the right hand on the top of the head, and I just flex the elbows. They should be at the same level. Okay. Remember to be very gentle with your patients, and also remember or take note of where you're touching your patients. That's very important. Okay, so more or less with the posterior part, we want the shoulders to be nicely aligned so that there's no rotation. So I just make sure that the patient, that area is nice and straight. And then can I ask you just to push your lower back slightly forward for me? Okay. Like, no, this part, yeah? Yeah. So just to lift that way. Okay. So the idea is that you don't want rotation. So even though you're just doing the T-spine lateral, just make sure that the entire back is nice and straight so that you get a good view at the top and the bottom. And the same applies with the chin. The chin should be nicely elevated, just so that there's no supine position on the front area. Okay, so the centering point for your T-spine lateral is in your mid-coronal plane, midway between the jugular or sternal notch and the Ziphy process, which should bring you more or less at your level of T7. You could also use the inferior angle of your scapula as another reference point for centering. Okay, so the other thing is just to remember, you still need to use your lead protection for both your AP and lateral views. And then to improve the image quality of your picture, you can actually use a little sponge which you can actually place at the curvature of the hips or the waistline. So this is more familiar in your female patients. So in this case, you can just push the sponge in that way, you can relax. And then the other thing, so this just sort of reduces the curvature of your spine again. And then the other thing that we can do is to place your leg shields at the back here. That just helps with the image quality. So it just reduces the scatter radiation and improves the contrast detail of the image. So the other thing that we just need to mention is to place our markers. So we can just our patient, the left side is closest to the image receptor, so we are demonstrating the left side of the T-spine. So we can place your marker readable, just place it on the top, and that should be fine. Okay, so for the evaluation criteria for the T-spine AP view, we are going to use the acronym REAL-M just to discuss the main points for evaluation criteria. Okay, so starting with your rotation, no rotation is evident when the right and left sternoclavicular joints are equidistant from the spinous process, which is this here. On this image you can see that there is a bit of slight rotation because the right sternoclavicular joint is greater than the left sternoclavicular joint. Okay, when it comes to exposure, you should see even density in the upper and lower portions of the thoracic spine. Remember that we did mention to be able to achieve this, you can use your boomerang or wedge filters. Okay, so also with regards to your exposure, you should be able to see your you should be able to see a clear demonstration of your bony margins as well as your trabecular markings. This is also an indication that there is no motion in your image. Okay, when it comes to your anatomy, you should be able to visualize the vertebral bodies, your pedicles, your intervertebral disc spaces, your spinous processes, as well as your posterior ribs and your costovertebral articulations. That's basically where your ribs are joining onto the vertebral bodies of your T-spine. Okay, in terms of lines or your collimation, we need to collimate to the area of interest as mentioned before. Ideally, it's nice to collimate on your right and left side to at least 3 or 4 finger spacing on the right and the left side. Ideally, you can collimate superior and inferiorly. Just make sure that you are including your C7 and your L1 vertebral bodies. Okay, and remember that ideally we want to see the T-spine in its full length. Your medical legal requirements, you must have a lead marker. Your image must be nicely collimated. You should be able to have your patient identification, that's your patient's name, surname, your patient's patient identification number, the hospital identification number, the date and time of the examination. Also, you need to somewhere on your image you should have the dose that was given to the patient or your exposure index. Also remember to check your x-ray for any artifacts, and yeah, that's about it when it comes to evaluation criteria. Actually, moving on to the pattern recognition for the T-spine AP view, so we're going to use our acronym ABCS. So starting off with alignment, we're just going to look at the spinous process. We want to see the alignment of the spinous processes. So if you look here, ideally what you want to do is just to, maybe we can try, you want your spinous processes to go all the way from your C7 going all the way down to your L1. So on this image we can actually see that there is a bit of deviation of your spinous processes, and for me it's more likely due to actually rotation. So it's possible that this patient at the hips, they were not nice and straight at the hips, because you're getting the deviation more on your lower portion of your spinous processes. Okay, so with your bone structures, you need to check the bone margins, trabecular markings. You also need to check for any abnormal densities within the bone. You must also be able to assess your vertebral heights. Also, you need to check for any widening of the interspinous or your intervertebral disc spaces, and you can also check for any fractures. Your most common fracture in your T-spine is your compression fracture. Okay, so calcifications in cartilage, you must check for any calcified areas on your x-ray. You can assess the cartilage by looking at your intervertebral disc spaces. Okay, when it comes to soft tissue, you should be able to see your airfold fluid, your airfold trachea from your C7 going down to around T4, and then your mediastinal structures. Here you're looking at your heart, your hilar region, and then you have your you just check for any artifacts on your image, and that's basically it for your pattern recognition for your T-spine AP view. Okay, so moving to the evaluation criteria for your lateral T-spine view, we also going to use your real M. So in terms of rotation, no rotation is evident when the posterior aspect of the vertebral bodies are superimposed. So that's basically this area here. Also, no rotation is evident when the posterior ribs are superimposed. If the superimposition is 1 centimeter or less, this is acceptable. Okay, moving on to your exposure, you must have sufficient exposure to see your bony margins and trabecular markings. There shouldn't be any motion evident on your image, and this can be indicated by having sharp margins of your bone structures, as well as being able to see your lung markings nice and clear. Okay, so take note that on your lateral view of the T-spine, when you're setting an exposure, you must consider the thickness of the upper portion of your T-spine in the lateral position, because the shoulders being superimposed tends to increase the thickness of that area compared to the lower portion of the T-spine. Okay, so moving on to the anatomy that you need to see. You should be able to see your vertebral bodies. You should be able to see your intervertebral foramina. Your intervertebral joint spaces should be nicely demonstrated. If there's some situations where you are positioned nicely but your intervertebral disc spaces are not superimposed, you can tilt your tube 7 degrees cranially. Okay, coming back to the anatomy, if your area of concern is T1 to T3 and it's not well visualized because of the shoulder superimposing on that area, you can do your C-spine swimmer's lateral, just to get a better view of the upper portion of the T-spine. Okay, moving on to your lines, your collimation. Again, you just want to collimate anterior to posterior such that you are including your entire vertebral column or thoracic vertebral column. Remember not to collimate too much superiorly and inferiorly. And then your medical legal considerations, again it's the same as your T-spine AP. You must have a lead marker, you must collimate sufficiently, you must have your patient identification, that's your patient name, surname, your patient identification number, the date and time of the examination. Also include your dose or your exposure index, and then remember to check for any artifacts on your x-ray. Okay, so in terms of pattern recognition for your lateral T-spine alignment, so basically you're looking at your anterior alignment along the vertebral bodies, so that's that way, as well as your posterior alignment of your vertebral bodies. Sometimes I think they just use these measurements to determine the maybe the curvature of the spine, and also if there's any kyphosis for this patient. Okay, in terms of your bone structures, again you need to check the bone margins, your trabecular markings, check for any abnormal densities within the bone. You must assess you should be assessing your vertebral height, so the height of your vertebral bodies. Sometimes if the height of the vertebral bodies is smaller compared to the other ones, that could be an indication of a compression fracture. Okay, remember also you can check for any widening of the interspinous or interpedicle distances and your transverse processes along this area here. You also check for any fractures of your vertebral bodies or any
of the thoracic vertebrae. Okay, so when we come to your calcifications and cartilage, you're looking to see if you can see any calcifications. You can look or assess the cartilage based on the intervertebral disc spaces. So if it's a narrower disc space, it's more of an indication that there could be maybe a problem with the cartilage between those vertebrae. Okay, your soft tissue, basically you're just looking to make sure that you are able to, you can see your soft tissue posteriorly. There's your lung tissue here. You're also looking at your mediastinal or your hilar region in this area. And yeah, that's about it. You're checking to see if there's any artifacts in your soft tissue, if there's any also different densities in your soft tissue. So all of that just needs to be considered. Okay guys, I hope that video was insightful to you and it has helped you. If you have any queries, please feel free to send the email or send a message to your class rep or to Mr. Mazibuko, and wherever I can help, I will try to help. Thank you and have a great day.